Hello, my name is Dr. Charles Durr, and I've been practicing chiropractic here in Downingtown, Pennsylvania for the last 12 years with my partner, Dr. Joseph Childs. And for the purposes of this video, it's important to understand that I'm certified in functional blood chemistry analysis, which is a nutritional approach to healthcare based on blood chemistry and nutrition. Now, I'm here to talk to you today about autoimmune disease. Now, autoimmune disease can be characterized by sudden flares and remissions, or spikes and ebbs, so to speak. And unfortunately, there are many autoimmune conditions prevalent in our society today. To name a few, celiac disease. Now, celiac disease is an allergy to the protein in gluten or wheat products. And celiac disease is a severe form of the disease. You can have gluten sensitivity, which is kind of a step below it. Now, celiac disease is so severe that it actually shows up in blood work. And unfortunately, gluten sensitivity, which many people walk around with undiagnosed, doesn't get picked up by traditional blood work, and we'll get into that in a little bit. Diabetes type 1. That's when your immune system mistakes your pancreas as in either a virus or a bacteria, and it sets off and attacks and basically kills your pancreas. And you have to then go on insulin to manage your blood sugar, unfortunately. Hashimoto's thyroiditis. This is an autoimmune attack on your thyroid gland. So what an autoimmune attack is basically is your body mistakenly sees a protein within your body and thinks it's a virus or a bug, okay? And that protein can be your own tissue, and it's often triggered by some things we'll discuss in a little bit, right? Multiple sclerosis, which is an autoimmune attack on your brain and spinal cord, right? Causing a variety of severe neurological problems. Rheumatoid arthritis, which is an autoimmune attack on your joints and cartilage, disfiguring your fingers and hands and causing very much physical disability. Scleroderma and psoriasis, very similar in their symptomology. They cause outward rashes, scarring, and joint erosions as well. Right? And then there's lupus and Sjogren's syndrome, just to name a few. All these are the same disease, just that there are different tissues being attacked by your own body. And most people understand that it's a problem with your own immune system that's causing these diseases, not some invading organism of some sort, right? So an autoimmune attack is usually treated medically with corticosteroids during the acute stage. And unfortunately, corticosteroids are only good in severe emergencies, okay? They're the equivalent of the fireman breaking through your front door, squirting a hose all throughout your kitchen to put out a pot and pan fire. They walk out and they leave your house a mess. Yes, they put out the fire, but the metabolic after effects are devastating on the body. So anybody who uses corticosteroids for a chronic condition is going to end up with some problems just as bad, if not worse, than the disease they're taking them for. So taking corticosteroids, other than for acute emergencies, is definitely something you don't want to be doing on a regular basis. And then the second course of action is immune suppressant drugs. So in other words, they're not trying to identify why the immune system is going off the rails and attacking itself. They're just going to say, hey, let's suppress the immune system. But the immune system fights viruses, it fights bacteria, it fights cancer. So if you're suppressing your immune system, you may not have the symptoms of this autoimmune disease, but you're going to get viruses, you're going to get bugs, you're going to get cancer, unfortunately, at a higher rate if you're on those medications. So suppressing your immune system is definitely not something you want to be doing as the end-all be-all for your immune problem, right? So what makes us different from other doctors that you've seen when it comes to your autoimmune conditions? Well, first and foremost, we leave no stone unturned when it comes to trying to identify the root cause of the autoimmune condition, not just giving something to abate the symptoms, right? And that starts with our metabolic care program. The first and foremost thing we need to do is a very thorough blood work, a complete blood panel, okay? Lipid panel, a CBC with differential, thyroid panel, and that's to name a few. Right. Now, the traditional blood work you get every 6 months or so with your annual checkup is a very limited panel. It usually has a Chem 7, it has maybe a CBC with auto differential, maybe not. It usually has TSH only. And in our CBC, we do always an auto differential. We do a Chem 24, we do a T7, which is 7 different thyroid tests, and we test for the auto antibodies. Okay? Now, this is just the basis of our program. We have to get then further into other testing. But it's important to understand that we use a different value when looking at blood work. I mentioned earlier that I'm certified in functional blood chemistry analysis. A functional blood chemistry analysis is based on the average of healthy people. And a group of clinical chemists and some functional medicine doctors studied about 5,000 healthy people. In other words, they had no disease processes, they took no medications, and on examination we couldn't find anything wrong with them. We averaged their blood work and we came up with what's called a functional range. So basically this is what the healthy person should have a value of their blood chemistries. Whereas the pathological or the laboratory range is based on a bell curve of everybody who gives blood. And if you've ever been in the waiting room at a lab or a quest, most people sitting there aren't very healthy, are they? And so every decade the bell curve gets wider and wider. And so we have to allow for more and more unhealthy people to be considered a healthy person. Okay? And that's unfortunately the way our healthcare system is going in terms of the health of our country. But for example, glucose. The functional range is between 85 and 100, and the laboratory range is between 65 and 100. So if somebody who has a 70 blood sugar is going to be irritable, shaky, weak before they eat, they're going to be irritable as heck in the morning, and they're going to feel better after they eat. Okay? This is the type of person you don't want to be near until they've had their coffee and their cereal. Okay? But according to modern medical standards, that would be nothing wrong with that person. Nothing needs to be changed. And unfortunately, glucose is just the tip of the iceberg of things that are underanalyzed in typical blood work. But then beyond the blood work, we have to get in some additional testing. One of them being the adrenal stress index, or what's called ASI. This is a salivary test that takes a sample every few hours throughout the course of a day. And what we're looking at is the cortisol levels at certain times. And for example, at 3 in the afternoon, you should have a very high cortisol level, and at 3 in the morning, you should have a very low. Right? And there's 7 full patterns of maladaptation that can occur in the adrenal gland. All right? So the adrenal gland is important for several reasons. It talks to the pancreas to bring sugar down. It talks to the liver to bring sugar up. And it secretes many neurotransmitter precursors and chemicals that keep the brain running properly. So if you're under a lot of stress, you're excreting a lot of cortisol, your brain can slow down, and your sugar metabolism can be dysregulated as well. So the adrenal gland is a linchpin for many metabolic pathways. So we have to see if it's dysfunctional, what pattern of dysfunction it has, and therefore what method to best rehabilitate it nutritionally. All right? Some other tests that we do are sensitivity, or more specifically food sensitivity testing. IgG in the stool. This is a very specific, very sensitive test. Most food sensitivities are done through blood analysis, and they don't use IgG. And unfortunately, you have to be severely allergic to something for it to be sensitive in the blood. For example, celiac disease. Okay? Now, we test for the big 5. It's called gluten, casein, egg, soy, and yeast. These are the most likely foods to cause an autoimmune reaction. And unfortunately, every decade it seems to be an exponential expansion of how many autoimmune conditions we're seeing. And unfortunately, it's caused by the genetically modified seeds that they use for all these products. Right? 20, 30 years ago, the antigenic load from these foods was very minor. But what they do is they deaminate the gluten, or they deaminate the casein to make it more, give it properties that are better for food manufacturing. And it makes it 10 times more virulent to the immune system. So we're eating a diet rich in processed foods and these genetically modified yeast organisms and gluten and the things we feed the chickens and the cows make their proteins much more irritating to our immune systems than they were 20, 40, 50 years ago. Right? So we have to identify what foods you may be allergic to, what foods you may be sensitive to, what foods trigger an autoimmune response within your body. And these are the big 5. These are the ones that most likely will be the cause of your autoimmune condition. But we have to do the stool test, we have to find out what they are, and then we have to eliminate them from your diet to get your immune system to regulate itself again and to stop the autoimmune destruction that's occurring within your body. The next test we have to do, or before I get into that, some symptoms of sensitivity. And so if you're sensitive to food, you'll get chronic pain and fatigue, you'll get frequent indigestion, fullness after meals, bloating after meals, frequent loose bowel movements, constipation, and in some cases vomiting. Those are just some classic signs. If you get those after you eat, you may be sensitive to the foods you just ingested. Right? Another thing we do is called a DNA stool ecology profile. So we have to look within the gut to see how much good bacteria you have. You should have 2 to 10 pounds of healthy bacteria within the gut for your immune system to run itself better, and for your thyroid to work better, and for your whole body to digest and run itself better. We have to look at how much bad bacteria you have. So you have pathogenic bacteria overgrowth. We have to look at that. We have to at least look at yeast, fungus, and for parasites. So if you have what's called a stool microbial antigen overload, that can cause your immune system to be on the active antigen response. It's overactive to bugs, and we'll get into why that's a problem in a little bit. But if you have antigens in your body from microbials, from bacteria, virus, parasites, and so forth, they will cause an immune dysregulation. They will cause an autoimmune attack to be worse than it should be, and will cause your health to be compromised as a result. So antigens have to be removed either through medication or nutritional ways or whatever way is possible. We have to remove them to reduce the load on your immune system. Okay. Next thing we have to look at is if you have intestinal permeability. Now, if you have antigens from food, or if you have antigens from bugs, and you have leaky gut syndrome, the problem will be tenfold because the antigens will escape into your bloodstream, therefore triggering a stronger immune response. So if you have undigested proteins escaping through your intestinal tract into your bloodstream, the immune system can identify them, tag them with an antibody, and the immune response is much stronger than it should be. And so that antigen has now been created. It's going to circulate in your bloodstream for 6 full months looking for the same protein. So every time you eat that gluten, every time you eat that casein, it's going to then be reactivated and more of them will be created, causing more of an immune response. And if you imagine when you're sick, say you have the flu, you're cold, you're hot, you're achy, you're sweaty, you're throwing up, you're having diarrhea, that's not the bug, it's the immune system that creates those symptoms. So what those symptoms are, you can extrapolate it to your joints if you have rheumatoid arthritis, extrapolate that to your thyroid, extrapolate that to your brain if you have MS. Basically, you have a cold or flu attack on your own tissue. And the problem is several-fold. It's antigens in the body that are triggering this response. It's a leaky gut that's allowing these proteins to get into the bloodstream, flooding the immune system with triggers. Okay? And so we have to identify that. Now, if you've had any type of antibiotic treatment before, if you had antacids, if you've had anti-inflammatory medications, you have leaky gut syndrome. And most people with autoimmune condition, the underlying problem is this leaky gut. Right? So you're on a kid, every time you have an ear infection, you go on a course of antibiotics. You kill all your good bacteria off. You're taking Advil. Every time you have an ache or pain, you're eroding your stomach lining. All right? You're taking antacids and you're not digesting your food properly, and those proteins are escaping through these erosions. And pretty soon you're developing an antibody load to the point where it gets big enough and you have outward destruction of your tissues. Whatever tissues, disease you have, brain, nerve, thyroid, pancreas, what have you, is triggered most likely by a leaky gut syndrome. So it's important to understand that we have to identify what type of autoimmune problem you have. There's two types, active antigen response and there's an immune dysregulation. Active antigens, like I talked about, are either foods or bugs. They get into the immune system, your body sees them, and it launches an attack thinking that those things are a virus or a bacteria or what have you. That in and of itself causes a problem. But then, if your immune system goes off the rails, so to speak, and sees a similar metabolically, molecularly structured tissue as this protein, it can then mistake it and start attacking your own tissues. For example, gluten has a very similar metabolic structure to your thyroid tissue, to your pancreas. So now you're eating these antigens, it's causing an active antigen response, your immune system attacking those structures, now they're going and attacking your own body as well. So if you have immune dysregulation, it means that you don't have enough control over the active antigen response. We need to support that part of the immune system to quell that on. Or if you have an overzealous active antigen, we have to remove antigens from the system to get that part of the problem under control. Or, quite frankly, we have to do both. We have to increase regulation, we have to decrease antigenic load in order for your immune problem to be under control. Right? Now, this involves extensive testing to identify the antigens or the type of dysregulation. So we do some immune testing and so forth to find out if you are an active antigen response or immune dysregulation type of patient. Right? And there's testing that we can do for that as well. But basically it involves removing antigens, healing the gut, taking control of your life by changing your diet and lifestyle. So if you're a person who's ready to make a lifestyle change your diet, remove antigens if they're foodborne, then this program will be very effective for you. If you're unwilling to participate in terms of changing your lifestyle, following the directions of the dietary recommendations, taking supplementation and so forth, then this program isn't for you. But if you or a loved one is suffering from an autoimmune condition and you're interested in getting this looked into further, we would be happy to schedule an appointment to do work upon you and let you know if you're a good candidate for our autoimmune disease recovery program. So if you are, please give us a call. Until then, I wish you luck. See you soon.